Managing emotions. Experiencing strong emotions is a normal part of recovery and a normal response to the changes that occur after a brain injury. It's common to feel irritable or easily frustrated, angry, sad, or anxious. These strong emotions can be difficult for you, but also for your friends and family. Feeling misunderstood by friends and family can also be distressing. In most cases, a mild traumatic brain injury is an invisible injury. The symptoms that follow a concussion are not visible on the outside. It's not like having a broken leg in a cast, and everyone can see your injury. It can be difficult for others to understand what is not working as well for you because it can't be seen. This can lead others to operate within a "you don't look sick, so you mustn't be sick" frame of mind. Misunderstanding and lack of awareness make it difficult to manage the expectations family, friends, a boss, or coworkers have of you, but also affects how well you manage your expectations of yourself. You and others might feel you should be doing more. You should be able to do this by now, or you should be better by now. Openness about your experience and providing others with facts about post-concussion symptoms can create greater understanding and relief from unrealistic expectations. As we continue to discuss emotional well-being, it's important to note that stress and anxiety can increase cognitive difficulties. The more stressed you are, the more difficult it is to think clearly. This underlines the importance of taking care and addressing your emotional well-being to support recovery from your symptoms. Here are some helpful ways to manage difficult emotions. First off, worry intensifies these feelings, which can lead to a vicious cycle. You feel irritable, you start worrying about how irritable you've been, and end up just feeling more irritable. Stop the cycle. Remind yourself that these strong emotions are normal in recovery, and choose to implement a strategy rather than dwell on not wanting to feel the way you feel. You can take a break, step away, or walk out of the room before getting angry or overwhelmed. Try to recognize triggers of your emotions. These can be thoughts, such as thinking back to an accident, or specific events or situations, such as a social gathering, or coming home from an outing to hungry and energetic children and feeling overwhelmed. It can be helpful to identify these triggers and try to find ways to manage the troublesome thought or situation in order to lessen the intensity of your reaction. Focus on what's in your control. We often worry about circumstances outside of our control, and this can distract us from what we can do. Similarly, try not to compare yourself with your old self or your normal self. This can worsen sadness and frustration. It's not to say that you shouldn't have goals or hopes to regain parts of your old self or activities you used to enjoy, but just not now. This is you now. Let the healing happen naturally and focus on what's in your control. Focus on what can be done now. Try to look at the positives, no matter how small, and focus on one thing at a time. You will be more effective and less overwhelmed by focusing on the task at hand rather than many tasks at once. Try to reduce the number of demands on you. This can mean delegating tasks to others, or minimizing your optional activities, or accepting that for this season in your life, you may not do all you want to do or expect yourself to do. We recommend practicing relaxation techniques such as deep breathing, progressive muscle relaxation, or guided visual imagery to reduce stress. Please visit our links to learn more about these techniques. Be sure to engage in a pleasurable activity or hobby you enjoy to bring some light into your day. Take a walk outside, visit a garden, practice yoga, listen to music, or talk with a friend. And it's important to talk with family and friends about how you're feeling. Seek their support and be specific about how they can best support you or what you need. Many people want to help, but may not know how. There are also professionals who can assist and help deal with stress, such as psychologists, a family doctor, a psychotherapist or psychiatrist, or occupational therapist. Depression and anxiety. It's normal to have days when you feel down or worried. And this can lead to questioning if you're depressed or anxious. Well, feeling sad or concerned are normal responses to losses and changes after a brain injury. They're not a sign of weakness, and it's no one's fault. However, if you do think you have clinical depression, or if your depressive or anxious symptoms are impacting your daily life, talk to your doctor. Depression and anxiety are treatable. After a concussion, you will likely be more sensitive to the effects of alcohol and drugs. Even a small amount of alcohol can worsen the effects of the concussion and can lead to increased dizziness, falls, poor judgment, and impulsivity. We recommend avoiding these substances while recovering. And remind yourself, get your rest. You are not being lazy. You will have good days and bad days. Pushing too hard will lead to setbacks. Be patient with yourself and ask your family and friends to be patient with you. You are recovering. You may not be there yet, but you're closer than you were yesterday.